The three anatomical components to cellulite that we're going to be treating with this therapy are the fiber septi. They create the valleys. They connect the dermis of the skin to the underlying muscle fascia. So we need to divide those. Also, we're going to treat the fatty component to a compartment. The fatty component creates the hill. So the hills and the valleys, but that hill, if we can take some of the fatty component out of the compartment, we're going to decrease the size of the hill. Now, because the skin's been stretched alternately and pulled alternately, then what you end up with is differences in the thickness to the skin, which contributes to these cobblestoning types of effects. So we'll turn that right angle fiber, again unique, onto the undersurface of the skin, deliver a certain amount of the laser energy by protocol. Once we do that, then the skin's going to be stimulated to increase its collagen as well as its elastin formation. With this particular patient, there's areas of contour that we're going to be addressing. At the same time, you can see the overlying cellulite, which is a more superficial kind of structural change in the skin form. So in her particular case, she's that mid-range patient. The most dramatic results, obviously, are in the patients who have the most dramatic amount of cellulite. In those mid-range, though, it's really the changes that occur are probably the best in that they really achieve, the smoothest skin texture. This kind of procedure we're doing under a local with a little bit of sedation. It makes the patients very comfortable. You can see that arrow pointing up. That's the direction the laser is firing. You can see that I can rotate it up and I can rotate it to the side. When I rotate it to the side, then I'll be using it very much like a scalpel for the septa. When I point it up, I'll be treating the undersurface of the skin. With the laser pointing down and a little bit to the side, I can take the fatty component out of those compartments. So that's really the key to this treatment. The red areas of depression, I'm going to cut across the fiber septi, and I may do that in more than one direction as I feel it release, and if I feel that there's a catch somewhere, then I'll turn the fiber in the other direction and basically try and release that zone. And you can feel it recur, and you can even see that that area of depression has come up. In comparison to the other side, which hasn't been treated yet, you still see the hills and the valleys as defined by the green and the red. But that subtle undulation that's occurring here in the skin, you can still see. We know that we've got a very good release on the other side that has been treated. We know that we've smoothed things out considerably. And inflammatory processes, some of the scar tissue formation, and some of the thickening of the skin is going to be an additional improvement in this area as well. This is a sculpting procedure. Liposuction itself is a sculpting procedure. And because I paint and I carve and I sculpt, and I've been doing that since I was 8 years old, I bring that aptitude to the table with that. It's a very fine kind of sculptor. When you think about taking a surface that has a marbling or a texture or kind of a cobblestoning and saying we're going to make improvement, you've got to be very precise. You've got to be very delicate in your application of your sculpting principles. And when you do that, you can see that kind of result. Post-operatively, you're going to get a little bit of drainage because this kind of laser wavelength that we use is not coagulating. In other words, it doesn't stop the bleeding like a lot of lasers do. But that's part of the component of why I think it works and works so well. In a day or two, you're usually back to most of your everyday activities. You do wear a garment, a compression garment over the area for about a 3-week period of time, but what's trying to do is we're trying to keep down the early swelling and bruising. You're going to see results very early in the process. The first week is when you've got most of your swelling and bruising, and you'll see the results even after the first week. But when the garment comes off in 3 weeks, the patients really claim to see significant advantage. And then as the months go by, when the skin thickens up, it gets better and better.